Seattle area plastic surgeon has developed a way to help people look younger without undergoing major surgery. Dr. Philip Young has created what he calls the Youngvitalizer, a minimally invasive alternative to traditional facelifts. Dr. Young is here to show us some of the amazing results. Welcome. This is great news, I think, for a lot of people. So tell us how you developed the Youngvitalizer and what's different about it from what we know as the traditional facelift.
Well, I trained in Los Angeles, so during that time I was able to see some results that I thought could have been possibly better. So that led me to this whole journey to try to find out, like, what was it that we could do to make things better. And that's where I came into finding a theory on facial beauty. And with that, I came into this new procedure that I think is, going to be really amazing for people, I think.
And you developed this yourself?
Yes, I did.
And so what is the theory that you developed that let you, kind of go towards a procedure that isn't quite so extreme? Because a facelift's a big deal.
Yeah, I mean, I think facelifts are pretty invasive. They entail a lot of incisions and a lot of cutting, and the complications are much higher. The chances of complications are much higher. And the difference is with our procedure, it's all based on filling and injecting and not using long incisions to try to rejuvenate your face. Essentially, when you age, essentially you lose volume, and a huge part of that movement is this inward and downward movement. And facelifts and brow lifts essentially just pull everything back. So if you notice, like, you started here, and then you age, you went in and downwards, and then you pull everything back with a facelift and brow lift. It's like nowhere. If you look at my hands, it's nowhere near where you used to be. So our whole intent with the Youngvitalizer is to actually put your face back. So you start here and you go down, and then we try to get you to get your face to be presented
Just
forward.
put it back the way it was. Yeah. So let us take a look at this. These are what you call the circles of prominence. Yeah. Explain what we're looking at.
Well, everything in the face has to have an ideal between 0 and infinity. I mean, if you think about it, and I think the usual location or anatomic unit that I talk about when I try to explain this theory is this part right here. If this little ala that covers your nostril, if it was totally gone, that would look odd. And if it was as big as your face, it would look odd too. So there's something in between that. And because we spend so much time looking at, we actually spend a lot of time looking at the iris, the colored part of your eye. And so anything that range between 0 and infinity, that's our measuring stick. So this pretty much explains
that's interesting.
it. Yeah, the width of the nose should be ideally about the colored part of your eye, and same with the nasal tip and the distance from here to here and the height of your lower lip. And that's something I found, and I actually sort of...
Now that's really interesting, because that's one of the things that people don't like about the traditional facelift is people end up looking sometimes not like themselves. So this is a great way to make sure that the proportions are correct.
Right, and it all has to do with what I was just showing you. Like, when you age, you pretty much move this way because you lose volume, and it tends to go down. And so we just tend to
Don't I know?
Yeah, well, you look great.
Thank you very much.
But it's all about putting your face, showing the parts of your face that are really important. And you can kind of see the main parts that you want to really present to people are your eyes, nose, and mouth. And the Youngvitalizer essentially does that. We want to present your eyes, nose, and mouth areas so that people kind of see in the light.
Totally get it. Okay, let's look at some before and after pictures, and this is good for men and women. So obviously here's a before picture.
Right.
Now let's what are we looking at in terms of problem areas here?
Well, one of the main issues that people have are the dark circles around the eye, underneath it, and traditionally what people do is they want to traditionally, like in the past, like 30, 40, 50 years, they wanted to remove those bags, and when you age, this is your lower eyelid and this is your cheek. When you age, you lose volume, and specifically you lose volume right in this junction here, and it kind of goes like this.
It collapses a bit.
Right, and traditionally people just take those bags and they move it back and try to get it to be more flat. But what happens is you end up looking a little bit more unnatural because it's not the way it used to be. It used to be this way, and then you went back and then you removed the fat, so it's not where it used to be here. So, and filling
I like this whole theory about just, going back to what it was that essentially made you look youthful rather than just stretching your skin over your face. So here's the after. That's pretty dramatic.
Right. So like his lower eyelids are filled more. Instead of because he really doesn't have any bags to remove, and a lot of times traditionally they would try to remove more to get it to not create the shadow where that lowered eyelid bag is currently. But instead we fill that that junction in to try to get it so it looks more natural. Like when you're young, you kind of have more of a fleshiness in terms of the lower eyelid to the cheek area.
All right, let's take a look at the before for the woman. And while we're doing this, tell me where, are there incisions? Where do you work
Yeah,
on the face?
we essentially just we inject. So you're not going to see, we inject in multiple different places in the face, like here and here.
So you're using fillers.
Right.
Okay. And so there's her before. Let's take a look at her after. My gosh, that's a really nice result. She must have been happy.
Yeah.
That, yes.
Her lower eyelids are filled in more, and
Right.
and she has less folding around her mouth, and her cheeks are coming out more, and it's presenting those things that are really important in the face, essentially the eyes.
And it looks really natural. So what's the recovery time? I am presuming this is much less expensive than a traditional facelift.
Yeah, like with traditional procedures, literally, you know, to get those kind of results, you literally can get like a brow lift, an eye lift, an upper eyelid lift, a lower eyelid lift, a facelift, lip augmentation, and so many different things that you can do around the mouth. And when you add all those together, they can be pretty expensive. So, you know, we can do most of that with just the Youngvitalizer and filling in certain areas and shaping the face in just the right way so you can get, you know, more rejuvenated.
Right.
So,
and recovery time?
Well, the recovery time, you know, compared to like traditional cutting, it's obviously a lot less painful. I mean, when you do a facelift and eye lift, essentially they can literally use like a whole bottle of pain medication. But with the Youngvitalizer, typically they may take like 1 or 2 pain pills, and that's usually the ones that we give them. So the recovery is essentially a lot better in a lot of ways, and the complications are a lot lower as opposed to traditional cutting, because you're not cutting and exposing all sorts of things that you could, you know, damage.
This sounds very exciting.
Thanks.
Thank you very much.
Thank you
Good
so
job
much.
on developing
Thanks.
this. We have go ahead. Yes, let's applaud. I like those results. That's absolutely fantastic. We posted more information online about the work Dr. Young is doing and about his Youngvitalizer treatment. So please just click on king5.com/New Day for details of a special offer just for New Day viewers. Thank you very much. Appreciate it. After the break, a performance by a talented young singer who's gearing up to entertain the fans of the Seattle Storm. We'll be right back.